There is one treatment modality with documented efficacy, remarkable safety, and unparalleled cost-effectiveness. Yet it is routinely underutilized by those who might benefit most. The treatment? Exercise. Perhaps it lacks the scientific cachet of a high-tech breakthrough, but for many patients, an exercise regimen approved by their doctor is a safe and effective way to help manage pain and increase mobility in osteo and rheumatoid arthritis. And it's an excellent way to help patients take control of their own treatment. Here are 5 different styles of exercise. For many patients under a doctor's supervision, each exercise offers its own distinct health benefits. Welcome to the next freedom. We invite you to join the movement.
Exercise is critical for both osteoarthritis and rheumatoid arthritis. I think yoga, in fact, is the kind of activity that gives you both muscle tone and a sense of well-being that's very important if you have a chronic condition like arthritis.
I was first diagnosed when I was in my mid-30s. I had gone to the doctor because I had severe swelling and pain in the knees, and he did some blood work and told me, in fact, that I had a form of rheumatoid arthritis. I've played piano since I was 5. Music has always been part of my life. Right after that episode with my knees, I noticed that my fingers hurt. I would sometimes have to stop because of the intricate movements that you have to do would pain my fingers. I always heard about yoga, and I was always fascinated by it, but it was something I thought I couldn't do. When I was 50, I gave myself a present of joining a yoga class, and I loved it. I noticed I was much more limber, and I noticed more strength in my hands. For me, the long-term benefits of yoga are vitality, energy, much better circulation through all of my limbs and joints, and a lot more flexibility. If a friend asked me what to do and they've been diagnosed with rheumatoid arthritis, I would first suggest a doctor, but I would definitely suggest exercising, especially yoga.
There's exercise that improves flexibility and joint range of motion. There's exercise that improves muscle strength, and then there's also exercise that improves muscle endurance. Weight training is a very important part of an exercise program for patients with arthritis because it increases strength in any age group.
As a certified trainer, when somebody comes in, I always try to find out if there's a real specific need of why they're here. And many times their doctors have recommended a light weight training because they have arthritic conditions, possibly in their shoulders, their wrists, or their knees. I have some arthritis in my hands. So what I've learned to do is I really start to work the hands like this, in and out. One of the benefits in weight training is the fact that you not only increase the strength process of an individual, but you also increase the mobility. And what I mean by the mobility, their range of motion. In the end, you will see a benefit. And it isn't a matter of living a long time, it's living with a quality of life. And that's really what exercise does for you.
Individuals that don't feel well, that come to the physician for help, need to have some measure of control and participation in their life. And insofar as they can, I think physical activity and diet are means in which a patient actively can participate and can be of great help and assistance to the physician in the maintenance of their health.
About 5 years ago, I was experiencing the worst pain I ever felt in my life, in my lower back, to the point that when I would get out of bed, I couldn't get out of bed. Getting into the shower was such an effort, I would actually have to have help sometimes to do it. I finally decided to go to a doctor, and the doctor told me after diagnosing me that I had osteoarthritis in my lower back. I started Pilates, and I have to tell you, I have total transformation in the way I feel. I can get out of bed without having any pain. I'm much more flexible. My blood pressure is lower than it's ever been, and I can't tell you how amazing that makes me feel.
Arthritis is inexorable. It is an unstoppable process. We do not know how to actually reverse it. So what we do is we set up an antagonistic process that is more powerful. And exercise is that antagonistic process.
About 7 or 8 years ago, I said, "Doctor, why am I limping?" He said, "You have arthritis in your ankles. You also have it in your knees." I said, "Oh, okay." He said, "You also have it in your hips." I said, "You gotta be kidding." Since I've been doing capoeira, I've noticed a wonderful increase in mobility. Before capoeira, I would not attempt, nor was I able to go into a deep knee bend. I wasn't able to go down on my hands for any length of time. Now I can. Once he discovered that I was doing capoeira, my doctor said, "Keep doing it. When you work the body, it helps you, it responds. If you don't work the body, you freeze up." I think capoeira has increased my range of movement, increased my confidence, increased my spirit. It's just amazing what the body will do once you exercise.
The physician's initial intention is to relieve pain through medication use and make the right diagnosis. And once that's made, exercise is often forgotten, and it's very beneficial to the patient to receive the whole course of treatment.
I developed extreme pain in the back of my neck. My hands were swollen. I could not fasten a seat belt, and I was in constant pain. I think rebounding is enormous fun. When I compare myself to women my age, I have an enormous amount of energy. I keep going. There's a reciprocal relationship between exercise and mobility. I think the more exercise you get, the more mobile you are. I think it has made a huge difference to me in terms of self-confidence, and I would recommend it to anybody.
If you are not getting a careful instruction about exercise, you're not receiving full and adequate care for the treatment of your arthritis.
I tell my patients that arthritis is significantly curtailed in its progress by good exercise. People will be able to do much more, much longer if they exercise.